Hi Susie, my name is Ashley and I am a nursing student that will be helping with your exam today. Is there any questions before we get started? Patient says no, so the first thing I will ask her is why she is here, and she states that she needs to get her yearly physical so she can play sports for college. And then I'm going to ask a few more questions and see if she takes any daily medications, has any allergies, any family history like diabetes, hypertension, certain cancers, anything like that. See if she's updating her shots, she's any health concerns, and any recent weight gain or weight loss. And then after observing the patient has good hygiene, appropriate clothing for the weather, is alert and oriented ×3, reports no pain, very kind, she's glad to be here so then she can start playing basketball. And then the next thing I'm going to assess is skin. So I'm going to explain to the patient for each step of this physical exam of the head to toe assessment so they know and understand each of these steps so they are comfortable and can ask any questions during this time. So I'm going to assess for texture, color, see if your skin's dry, and capillary refill, and so your skin is warm, dry, intact, no lesions or bumps on any of the exposed skin. Then I will start palpating the skull to see if there's any bumps or lesions. And then I will then palpate the sinuses and ask her to please let me know if it hurts at all. Then I will have her make some funny faces at me, like smiling, frowning, sticking at her tongue side to side, raising her eyebrows, that type of stuff. So her face is symmetrically bilaterally, no tenderness during palpation, no bumps or lesions were noted. Then I will assess the eyes. So I will first look around the eyes, the eyebrows area. Then I will, for EOMs, so you can use your finger or a pen light. I'm just using my pen without the light off. So you start in the middle, then you go to the side, up, down, back up, to the middle, across, up, down, back, middle. And then I will perform the Perla test, which means pupils equal round reactive light accommodation. And so pupils are round, they are equal and reactive to light and accommodate to the light. So EOMs, yeah, and Perla are noted. And then I will start with the nose next, and then I will ask if she has any congestion or runny nose. I will take an otoscope and look up the nose to see if there's any inflammation. And then I will palpate and then ask her if there's any tenderness with so there was no congestion or runny nose, no tenderness during palpation. And then I will do the mouth. I will have the patient open their mouth and say ah, please and thank you. And then while her mouth is open, I will assess the uvula, or inspect the uvula and the tonsils and the tongue and the teeth. And then I will also have her stick out her tongue and move it side to side. And this showed that there is no inflammation, sores, or anything in her mouth. Tongue is normal color, no sores or inflammation, and teeth are intact and in good shape, and they are her own because she does not have dentures. Then we will move on to the ears. I will palpate the anterior and posterior of the ears, and then I will note for any tenderness, any skin breakdown. She complains of any type of pain, which there was no tenderness noted during palpitation, anterior and posterior. And then I will also take an otoscope and I'll look in the ear to see if there's any inflammation inside that we can't see from our own human eye. And then I will inspect the neck. I will palpate the lymph nodes, the cervical nodes. So cervical nodes, lymph nodes, and then I'll palpate both the carotid arteries on each side, one at a time. And while you do this, have the patient hold their breath when you do the auscultation of these with the bell. And you do that on site, and they usually recommend that you as the nurse or whoever's doing this to also hold their breath so you don't forget the patient to remind them that they can breathe again. And then and you also just inspect for the normal skin. So skin has good color, trachea is midline, lymph nodes and cervical nodes are not palpable, and carotid pulse was 2+. I then will assess the upper extremities. So have you hurt your arm or shoulder at all? And then I will also ask if had any difficulties with lifting or anything. I will assess range of motion, push and pull strength. So you can go like this, and have them push the opposite way that you're pushing. Also that the brachial pulse is right here in the bicep, and the radial is on the thumb side by the wrist, and the ulnar is on the pinky side. And then you just palpate these. And if it's an irregular beat, just make sure that you count it for the full minute instead of 30 seconds and times 2. And then so palpitations were normal, no tenderness at all. And then we will start with pulmonary. So I will ask the patient if they've had any shortness of breath or a cough at all. And patient says no. I will auscultate the second intercostal space of anterior of the chest, which is just below the clavicle. And then posteriorly, I can undo this. This would be the upper, middle, and lobe right on the shoulder blade. For the lobes of the lungs, there's only 3 lobes on the right side and 2 on the left. And then when I am listening to the breath sounds of the patient posteriorly, I'm just gonna have them take deep breaths, and then also take deep breaths when I'm inspecting the back in the thoracic cage to see if there's anything abnormal. I'm listening anteriorly. I will also ask them just to breathe normal and stay relaxed. And so the heartbeat was normal, abnormalities noted, no abnormalities or tenderness noted, because I also forgot to mention that you palpate the spine and see if there's any tenderness for the patient. The patient reported no tenderness or pain. And then you will start with the cardiovascular, which is the heart. So Ask if they have noticed any irregular heartbeat or palpitations. There's 5 places you can look. Listen to heart. So it first goes, there's 2 of them. Aortic, pulmonic, which are both second intercostal. Third is Erb's point. Then it's mitral, which is 4th. And then the 5th is tricuspid. And then your the first one is on the patient's right, and then the second one's on the patient's left. And then I would use the diaphragm of my stethoscope during this process. And then I would note of any abnormalities, but there was no palpitations noted, no palpitations noted, and regular heartbeat for her age. And then we will move on to the abdomen. So I will ask if she's had any trouble with bowel movements or difficulty urinating. And then I will auscultate all 4 quadrants, starting with the right upper quadrant, left upper quadrant. Also, I forgot to mention that the S1 of the heart is the mitral and tricuspid, and S2 is aortic and pulmonary. But anyway, so then it goes left upper, left lower, right lower. And then you auscultate these each for a minute on each side. And then if you can't hear anything, you need to do it for at least 5 minutes until you hear something. And if not, document and report to your physician right away. And then I will do light, and they will be lying during this time also. But I will do light in the 4 quadrants, and they see if there's any tenderness or any bumps or lesions underneath the skin that I can feel, or if they have any pain. And then I will repeat this, but do deep palpitations. So no abnormalities, normal bowel sounds, no bumps or lesions that were noted during light and deep palpitations. So then I will move on to the lower extremities. I will ask if they've had any pain or swelling in the legs, and she says no. So I will just inspect the skin if there is any swelling at the time. And then I will do a couple testings, like the Romberg test, where they stand up, hands to the side, and see if they can go without swaying. Also, if you want to do further testing, you can also have them close their eyes. They also do like head to try touch your toes. Can you like you're about abduction and adduction? Some people don't know what that means, so a good example would be like, can you push your feet like you're gonna drive your car, but then also reverse it? And so Romberg testing was noted, was good. No edema noted, no pain or tenderness noted during palpitations. When I was doing the popliteal artery, which is the back of the knee right here, the dorsal pedis, which is the top of the foot, and dorsal pedis. There's one right here, but I can't remember the name. Dorsal pedis. There's one more. But anyways, maybe I'll hopefully remember by the end. So I had no concerns during the physical exam. I thank you for your participation and your time. and I will let the doctor know that you're ready for him to come in. Do you need anything before I go, is what I would ask. And perform hand hygiene, and then provide privacy until the provider comes back. And that is it.